Looks like we're live.
Okay. Hi, everyone. We're going to we'll go ahead and get started, right, Angela? All right. So my name is Athena, and I'm one of the volunteers with Hope for HS. Today, we have with us Dr. Jerry Tan, who's a certified specialist in dermatology with experience in clinical care, research, and cosmetic dermatology. He's currently practicing, conducting research, and teaching medical students in Windsor, Ontario, Canada. He's here today to talk to us about the HS patient decision aid. Dr. Jerry Tan, I'm going to hand the screen over to you and we'll go ahead and get started.
Great, thanks so much, Athena and Angela. I'm just going to share my screen and you know how that works. You cannot start screen share while the other participant is sharing. Okay, so let's just see. Okay, so I'm going to open up the patient decision aid to share with all of you. So this is really a labor of love because many years ago when my mom was diagnosed with colon cancer in Vancouver, and I'm not in Vancouver, I'm in Windsor, Ontario, which is right across the border from Detroit. And when I was visiting her, she said to me, based on her medical encounter, that she had come across a patient decision aid that the surgeon reviewed with her. And, you know, my mom is not medical. She really has limited kind of technical expertise. But what was valuable was how she found that process so effective in terms of understanding her options and helping her decide what made sense to her, without feeling like the surgeon was pointing her one way or another, but simply being presented with information that she could then make her own most rational decision about with his guidance. So that's what inspired me to do this. And what we wanted to do was to try to help HS patients make better treatment decisions. And we all know how difficult it is because there are so many treatment options and so many of them are not directly in research trials for HS, but have been translated from other clinical conditions. There are more research trials developing for HS, so we're all very hopeful that new treatments will be coming. So this is the decision aid, and I do want to thank a number of collaborators, including Christine Yanuzzi of HS Warriors for Research, Sandra Guibo of Hope for HS, the Detroit chapter, Christopher Syed and Barry Resnick, who were really extremely helpful in terms of helping review and encourage the development of this, this whole process. And then my research associates, Donna, Olivia, Tanya, Mia, and Bob Delaval from the University of Colorado, who was able to collate some funding by the University of Colorado to help us fund our research group. And I do have some conflicts that are industry-based also, including some of these companies that I've worked with for either acne, rosacea, or for HS, either as a consultant, an investigator, advisor, or speaker. So those are my declarations. Now, I wanted to just share with you this outline of how medical research is conceived. We start with problems. And we start with problems for which we have no answers. And where do those problems arise from? They arise from the clinical arena of patient care. And in that situation, patients provide us with the questions that we try to answer. And if we have no clinical answers, then we go right into basic research. What is the pathway? How does that inflammatory response develop? What other pathways are involved? And based on that, oftentimes we may be able then to find interventions that can help block or attenuate those pathways from being deployed so that we can reduce the inflammation, reduce the number of boils and so forth. So that's the ideal kind of way to think about, say, the whole medical research paradigm. Now, when these go through testing, these are called clinical trials. And as they come through testing and are approved, then now we have new drugs. And hopefully we'll have lots of new medications to help, at which point we have to do a systematic analysis to see what the effect size, that is, how well they work, and also how high the level of quality of this evidence is. That is it just a bunch of doctors saying it works, or is it based on a really well done, highly credible trial that is as scientifically rigorous as possible? That's called a randomized control trial. And from there, that information then moves into clinical practice guidelines to try to inform clinicians on the guidance of treating patients with that condition. Okay. Now, that looks like a circle, but it's not. It's a broken circle because there's one big piece missing. And the big piece that's missing is, what about patients? They initiated the whole search for solutions, but why does it not come back to patients? So that has been for a long time, especially with certain conditions like HS, one of the big questions for me. And as a dermatologist, I also try to address those gaps in other skin conditions that I do research in. So the guidelines for patients need to be comprehensive. That is, we talk about not just one treatment or two treatments, but the gamut of treatments that physicians use, and as well as being comprehensible, that is understandable. So none of the technical jargon that might confuse people, as much as possible using plain language, and then accessible. So information really is not that helpful if you just can't access it, if it's behind firewalls, if you have to pay for it. And I think all of those issues become a problem if we develop a good product that's not accessible. And lastly, it should have personal values and preferences so that it's really individualized and personalized for that person with that problem. And we don't presume that we know what the personal values and preferences are. We ask the patient. And that leads to a patient decision aid. And you'll notice that it's distinctly different than an informational aid. Information means you just get, it's like a data dump. You get information and information, but they don't ask you about how it's important to you, what your thoughts are about what is relevant in terms of your management and your treatment, and what your preferences are. So the hope is, by developing patient decision aids, it closes the loop to the people who need that information the most, rather than to leave this gap hanging. Now, you might think, well, that's all well and good. That sounds pretty straightforward. But as you know, sometimes things are not as simple as they sound, because number one, it has to be rigorously developed so it's credible. And there are international standards for patient aid, decision aid development. So we had to abide by those if we wanted to ensure that it was credibly done. The second part is, well, what evidence are you going to use? So we had to choose clinical practice guidelines, and we had to choose ones that were relevant for the constituency. So remember, this was funded by the University of Colorado, which means that we had to make sure it was relevant to the United States. And then it has to be comprehensible. We talked about lack of medical jargon. Comprehensive, we looked at the spectrum of options that were in the guidelines. And then it had to be available whenever, wherever. So it's complimentary, it's online 24/7. The guidelines that we chose to be the pivot point were the North American Clinical Management Guidelines for HS, published in the Journal of the American Academy of Dermatology. So that's the appropriate venue for the appropriate audience. That is the American Journal in 2019. That's the most recent one that was published at the time of our development of this decision aid. So what does it look like? It looks something like this. I'm going to take you on a full tour in a moment. But basically, when you go to the landing page, which is inform-decisions.org, it will bring you to a landing page with a decision aid for acne, psoriasis, and hidradenitis suppurativa. If you go to the hidradenitis suppurativa one, it introduces the topic to you. It asks whether you want to register. Registration will simply save your progress so that when you come back to it, you can just go back where you left off. It will also save your patient summary report for you so that that way it's available for you to review. And then you can come back to it in the future and just change things up if you find that you have modified your decision or your values. So it will all archive. You should know that the only reason we get you to register, number one, is so that we can bring you back to where you left off. Number two, we do collect information on how many times this decision aid is used. And then we only collect data on where it's used from. We don't collect any other data like URLs and so on, because that's not of, we want to make sure that this is patient private, but we also do want to know that it's been used by North Americans, and we want to understand if there are other jurisdictions that are using it, and we just don't have adequate language translation to those countries. For example, it is currently only in English, and it is not in Spanish, although for the United States, I think that would be an important translation for us to consider. And it is not in French. And in Canada, that's our second language, and we do not have a French translation. And you might say, why? We didn't have the funds. So we developed it in English, and as hopefully time develops and we get more funding, then maybe we can move on to making sure it's more widely available in different languages. Okay, so as part of the development process, we published on what we did in the patient decision aid. And so all of this information is actually open online, which means that if you want to look at what we did, it's completely available, it's free. And if you simply go to this reference, Dermatology Online Journal, you'll find it, and it details how this decision aid was actually developed. Well, that might be fine and good, but does it really do what it says it's going to do? Does it actually improve treatment decision-making? And we want to see that it does what it does. So what we did was to conduct what's called a randomized controlled trial of the decision aid against the content from the Mayo Clinic HS website. And we chose the Mayo Clinic HS website because of recommendations from both Christine Yanuzzi and Sandra Guibault, because they were indicating that many of their constituents were using those sources as ones that they found useful. So we want to evaluate against the best informational resource that was available. So we did a one-to-one assessment. Patients were blinded as far as which resource they got to evaluate, and they would then randomize into two groups. One group of whom received the HS patient decision aid, another group of whom received the Mayo Clinic content online information. And when it was all said and done, we ended up publishing. Again, this is an open online journal, so you can access this paper if you go to the JAAD International. And this details what we did and what we found based on that randomized controlled trial. So at the end of it, what did we find? Well, the results were the following. Compared to the Mayo Clinic, those patients who used the patient decision aid for HS had greater amounts of knowledge about their condition, about how it was graded, and about the treatments that were available. Number two, they were more prepared for treatment decision-making after using the patient decision aid. And number three, there was less decisional conflict. They were less uncertain about which way to go. Okay. So that's everything we want to do and we're hoping for with the effectiveness of a patient decision aid. So that was extremely reassuring. And beyond that, the questions then might be, okay, where do I find it? informeddecisions.org. I told you about the other decision aids that are there, and HS is the most recent addition to that family. What is the benefit for an HS patient? Well, number one, you can be more informed. That's what we found compared to the Mayo Clinic website content. you can be more prepared for treatment decision-making. And number three, you can make better treatment decision choices because there's less decisional conflict. And on the side of the doctors, what they'll be seeing is more informed patients, more engaged patients, because they've already been through the content about what HS is, as well as how it's evaluated and graded, as well as what treatments are available. And they will be coming in with clarity on what is important to that patient, their values, your preferences. And it's extremely time effective because a lot of that information, that background work and thought and reflection is done by the patient, for the patient, at the time that the patient finds it convenient. And I have to tell you, oftentimes in the clinic, it's really not a great time to reflect on values and preferences because you may have another appointment you need to get back to, or you have to get back to the office, so you have to pick up the kids from school, and the doctor might be running behind. So there are a lot of different pressures in an office clinic environment, and having it available to you when you need it, when you can engage in it, is, I think, one of the most valuable resource allocations that we can make for you. So the entire reason we developed this was to help patients with treatment decisions, helping patients with HS. And the future directions of this type of project is to make it a living one, that is, as new clinical practice guidelines come out, that we can refine and update this. And then hopefully this type of project can also be overseen by an HS foundation so that it can be maintained and properly nurtured so that it can continue to help patients. Now, at this point, I'm going to just stop sharing just for a moment. And should I take questions at this time, Athena or Angela? Because if not, I can move right to the decision aid itself. So feel free to let me know.
It doesn't look like we have any questions now, but if any participants want to put in questions, you can use the Q&A and we can get back to them.
Great. Okay. So let me just go back to share screen, and I'll go to the decision aids itself. Okay, can you see my screen about informed med patient
Yes.
decision aids? Okay, thank you. All right, so I'm on the landing page. So I just wanted to give you a little tour of the patient decision aid. Informeddecisions.org is the URL, and it asks you to select the decision aid: acne, psoriasis, HS. So let's go to the HS one. We'll view it, and I'll take you on a tour of this particular one. I wonder if it's going to be a little slow and laggy because I'm actually on Zoom.
It's possible.
Yeah, it's very slow. So I think oh, you know what I can do? Let me go back to Zoom, and maybe I can stop my video. Do you think I'll make it faster?
That could help.
Okay, let me just stop my video. And so voila. So this is the landing page for the HS patient decision aid. And it basically welcomes you and indicates there are 6 steps to guide you through this process, starting from intro to my decision. So this is your final step. And at that final step, you can actually print those results to bring with you to the clinical encounter with your dermatologist or your surgeon. And that way they're clear about what you've thought about as well. So I just wanted to show you a couple of things that we built in. One is symbols to know. And these are based on levels of evidence from 1 out of 3 stars to 3 out of 3 stars, where 3 out of 3 is the strongest level of evidence. So that wouldn't be incriminating evidence. That would be definitive evidence, or as definitive as we can make it in clinical research. The strength of recommendation is based on how good the level of evidence is, and also whether there's adequate risk benefit considerations, and whether most patients will want to consider using that treatment or not. So again, it's out of 1 to 3, where 3 is the highest strength of recommendation. So part of the reason we put all of this in is because the more you want to know about how this was developed, the more is available for you to look into. Words to know, we talked about 1, 2, 3, ABC. And in pregnancy categories, this is the previous FDA category for pregnancy risk. So usually we talk about B, C, D, and X. There are no pregnancy category A categories in any of the medications that are used, because that requires a randomized controlled trial. And quite frankly, it would be unethical to conduct a randomized controlled trial in that group of population of patients who are pregnant. It also talks about what a serious side effect versus what other side effects are. Serious side effects here are ones that we mean can cause death, damage that cannot be reversed after you stop, or severe lifelong impairment. So those are the ones that I think are really ones we wanted to focus on. So let's just give you an idea of what this looks like. Let's go to introduction. We're going to start now. And this is really just basic content. What is HS, patient decision aid? What's it here to help you with? And then we talk about what is HS. So we've hidden some of the photos in case you don't want to view it. And if you do, feel free to click it on. You can see that my colleagues generously donated photos, both Dr. Syed and Dr. Resnick. And then how can be graded and classified? Because that way you understand when your doctors talk about Hurley 1 or Hurley 2, what that refers to. Okay, so it talks about Hurley staging. And then we move on to talk about etiology and who gets HS. So a lot of this is based on the studies that have been done on HS, and many of these studies, some excellent studies coming out of the USA. What causes it? Well, we don't really know. And there are lots of labs that are searching because they're trying to understand how to help attenuate and reduce those inflammatory signals. Risk factors, other conditions associated with it. How might HS affect me? What should I do? How can I manage my pain? How can I manage my wounds? So a lot of good background information about the condition, along with some practical information that is useful just to be aware of, that is common to a lot of patients with HS. Now, if you continue, then it asks you whether you want to log in. And if you do, feel free to do so. If you don't, you can just continue as a guest. And if you continue as a guest, it brings you to a list of what's called My Options. And these range from no treatment to topicals, pill treatment, biologic treatments. Those are the injectable proteins, immunosuppressant medications, lights and lasers, surgery, and then complementary and alternative treatments. So there are as comprehensive a group of treatments as we could find that were discussed in the North American guidelines. And if some of them weren't in the guidelines, our research team went in to dig a little further to try to get more information to help patients. And then it goes through, and you can see this on the side panel, as in terms of what it is, how does it work, who is it meant for, and so on. So that way it's really clear what the appropriate use of it is, as well as the levels of evidence for this treatment. And then possibility of not just benefit, but also risk. So side effects, and then special situations and inconvenience factors. So it gives you a fairly comprehensive view on what treatments are available for HS. Now we move on to how severity is evaluated, because most of the time, treatment is going to be based on severity. And severity has two components. One is clinical severity in terms of what lesions, how extensive, where it affects you. And then the other one is severity based on impact, which is your quality of life, your pain levels, and so forth. Okay, so this is simply clinical severity. And it gives you an idea of where you can mark down where your lesions are on this cartoon. And then it gives you an idea also of what the different levels of severity is for HS, Hurley 1, Hurley 2, Hurley 3 at different locations, okay? And you can also indicate the area in the diagram where your HS is the most severe or where it bothers you the most, because we know everyone's going to be potentially a little bit different in terms of impact. Then you can indicate how severe is your HS in terms of the photos you just saw, so you can match it to the photos. And then let's think about you, not just about what the clinician might see, but how painful is your HS? And you can grade that on the scale. And then how much has it negatively affected your life, okay, in terms of quality of life impact? And again, you can rate that here also. And these are two questions that are really important for your doctors to understand, because what we see isn't necessarily how you feel, nor how it impacts your life. So you know, it's important for us to ask those questions so you can help give us a more complete picture. We ask then about history of your HS. And then we move on at this point to my values. And these are values regarding aspects like serious side effects, how quickly you want to see treatment effects, how long does the treatment take. And we know that all of our treatments are meant to control, none of them cure, unfortunately. And then how well the treatment works. And some of them are going to be more effective than others at clearing up HS, but quite frankly, oftentimes we don't know in that individual patient how well it would work without using it. Of course, different treatments vary in cost, and some might be covered on certain plans, some might not be. And, you know, we all have different plans in terms of medical coverage. And quite frankly, some of us have no plans. So it's important to be aware of the cost issue as well. And then convenience factors. If it's a pill, maybe it's really simple. If it's injections that you have to give yourself at home, maybe that's okay, but maybe you're needle averse. Or maybe some of these medications need to be done at a specialty clinic with intravenous. So you can see there are lots of different possible variations in what's important to patients, and you can assort the ones that are important to you here. For example, you might say, well, you know, I don't have a drug plan, so costs will be really important to me. And then the second is, of course, I want to know that the treatment's going to work, so I'm going to move that up. And I'm really worried about serious side effects because I have 2 young kids at home. And the ones that are also important is I need it to work quickly. I just don't have a lot of time to be giving myself injections, let's just say. And then the least important is length of treatment. And maybe there's something else that we missed that you would like to also let your doctor know, and you can add it here. Okay, so this allows you to personalize and add in more information that is relevant, especially in your situation. And then the next part is asking you what treatments that you may want to consider. Okay, and you can put in any of these, all of them, or none of them. It's totally up to you. And then once you've done that, we then allow you to compare your treatment considerations to what is the matchup in terms of cost and the treatments you've actually selected. Let's say I was particularly interested in topicals, and I wanted to know, want to make sure that this treatment works extremely well. And you can see, unfortunately, topicals are kind of not that terrific in terms of working extremely well. But on the other hand, if you have mild HS, this might be a reasonable option because you also don't want to deal with a high cost of systemics or a high risk of serious side effects with systemics. So this might be one of those compromised types of situations. But if you wanted to see even more information, and you know what we've tried to do is green is that it's a really good match with your values, and red is it's not a good match with your values, and you know, yellow and this hybrid is in between, then it gives you an idea of how we're kind of helping you look through choice versus the concordance with what you had selected. Now, if you wanted to see a larger table, you just click there and it just gives you more detail. Okay, because some people will want that type of detail, which is great. And if you want it, just click that extra button. If you don't need it, or you've already seen it and you just like the simpler box, then you can come back to this really simple. We call it the consumer's report version, because my entire reason for doing this was based on how simple and intuitive consumers reports are. So I think that's a really intuitive way of doing it. And then your decision might be, okay, now I've thought about it, maybe I'm really interested in topicals, and you can enter your reason. It has few serious side effects, for example. But on the other hand, I'd still want to learn a little bit about systemics, and because maybe there's greater efficacy or effectiveness. Okay, so you can type that in here. And the reason it's important for you to consider doing that is because it gives you an idea when you bring your patient summary sheet into the doctor, how you were thinking this through. And at the end of it, I listed no treatment as my first choice. Okay, that's actually not true. Do you see how I did it wrongly here? This is actually most preferred. This is, I prefer treatments. So let me just move that around, and systemic should be number 2. There we go, because I would prefer treatment. And then it asks you about making sure that you're certain about the best choice for you, about the benefits and risks. Do you have enough information about that, and have support and advice to make a choice? And you might say at some of these, no, I don't have enough support and advice. And if the physician sees that, then of course he'll try to make sure you have enough information. And then at this stage, are you ready to talk to your doctor? And if you are, you can print the results of this decision aid and bring it to your doctor, or you can save it and export it to a PDF so it's available for you. And you can save your results and come back to this aid at any time so that you can review it through again. Okay, so that's the decision aid. And I'm going to stop here. I know, let's see, cost. Now I'm just going to address this question that came up. So I'll probably answer this live if that's okay. And if it's not, feel free to let me know, Angela or Athena. So cost is almost always an issue, and what the doctor is willing to do based on the kind of insurance you may have is also an issue. I've had this kind of this disease for 22 years, and I've yet to receive proper treatment because of this. What do you recommend? Okay, so I think one of the issues is, I agree, cost will always be an issue. And there are many treatments that are going to be developing over time. And some of these treatments are actually in clinical trials now. Now, one possibility is, depending on your severity of HS, is to look for a physician near you who is actually involved with one of these HS trials, because we've routinely seen that many of these investigational medications work extremely well. And in that situation, you'll find that it will not be of any cost to you, and the cost will be underwritten because it's in a clinical research trial. So that would be a good first step, is if cost is a consideration and you feel like you're not getting adequate care, is there a clinical trial on HS near you? The second is to find a clinical specialist who is especially interested in helping patients with HS. And there are physicians across the country and in different countries that do have that focus to try to provide as effective and complete care as possible to HS patients. I do want to let you know that HS is, and you know this, it's a very it's not a straightforward condition to address in many office-based clinics. There are oftentimes minor surgeries that need to be done. There are excisions that might need to be done. There are perhaps dressings that need to be changed. So many clinics are not really well equipped to do all of that, but there are specific clinics that are looking to be kind of more helpful and more focused on HS or on wound care. So those would be good places to start. And I hope that provides you with some guidance. I also want to tell you that unfortunately, we have no best option. We're, on the medical side, we're still looking for the best route to proceed with to help HS patients. And everyone we know is different. They have different levels of HS severity. They have different areas of involvement. People also, of course, have different circumstances in terms of what they do in their life. So all of those aspects are things that we need to balance in the absence of kind of super therapies. So I also want to be very positive for you, though, is some of the trials that have been done on HS with new interventions have been extremely effective. So I think we're probably going down the right path, and there's a lot more investment now in HS research than there ever was. So I think we're in a good place to try to help. Okay. Can you go back? Oh, let me just see. Does the decision aid evaluate various drugs? I just went to an HS specialist and he prescribed rifampin and Clinda and was concerned about taking them because of potential C. diff. I did start taking them because he said it was helpful recolonization of pathogenic bacteria. So yes, the decision aid, if you take a look at it, at the area of the different treatments, we'll talk specifically about the medications as well. And that's going to be your treatment options section. So it will provide you more detail there. But quite frankly, the thing about a decision aid, it just can't give you the same level of detail that can be done in a clinical encounter or in a medical document. Because if we made it too detailed, then it would be one extremely long piece. Can one print out the spreadsheets comparing the elements? Actually, I think you should be able to. I've never tried to do that, but you can actually potentially print out, because this is all online. And if you wanted, you can just screenshot each relevant page and then print that out. So I think that would be fine. And if you wanted to, have it on your computer and then just screenshot print, that's fine. Or you can simply screenshot save into your photos so you can go back and refer to it as you wish. Can you go backwards? Look back at the choices you made before and change? Absolutely. There's no reason why this is, we're trying to make this as flexible as possible, because certainly we understand people change their minds. They want to rethink things, and that's absolutely fine. So there's no reason why you can't go backwards. Actually, as you see on the screen that I'm doing it now, I'm kind of going backwards. So there's absolutely no problem with that. Okay. Could you add these to the questions and answers? Okay, I think
That's just my comment. So we do have a couple questions from Facebook. We could take those now. The first question is, are atypical HS locations also available to put into the illustration chart where you can show where your HS flares are?
Oh, that's a really good point. Yeah, if you take a look at the My Skin section, it actually is pretty comprehensive. Like, that's an entire body, the front of it, the back of it, as well as the feet. So yes, you can indicate wherever you have lesions on that cartoon. Absolutely.
Okay, and then a second question, you addressed this a little bit about the kind of the lack of funding for other languages. Like if there was proper funding, what languages do you think that this could potentially be translated into?
Quite frankly, I think we would want to know from you. So are there communities that have HS that just can't can access the information but can't adequately understand it? I would think that Spanish would be really important, but I may be mistaken. Maybe that's a non-issue if most of the Spanish-speaking HS patients also speak English. And I think to help patients across the world, we need to try to help, because I don't think HS is going to be localized to one area, but even to make this a simpler version where it's not quite so detailed, but so that patients can understand enough that they can go to their doctors, whether they're speaking different languages, to try to make sure that there is a dialogue between the patient imputing and inputting what's important to them, the values and preferences, along with information about HS, and then engaging in dialogue with their physicians. So I think the two major languages I can see are probably Spanish in the US and probably French in Canada.
Okay. Those are the only questions that I've seen on Facebook.
Okay. Okay, so I love to see the whole spreadsheet with boxes shaded based on my choices. I'm better with words than images. Absolutely. So, feel free to take the spreadsheet and, box it in a way that you wish, because the intent is to try to make this as practically useful for you. And of course, we can't ever make it perfect, but we can always try to make it better. So if you're able to do that, I think that'd be terrific. Okay, so just as a reminder, the landing page is informed-decisions.org. You should know that we don't get anything from this. There is no royalty, and this is open source. If anyone wants to build on this and move it as progress develops further, I'm more than happy to collaborate and provide that, because the hope is trying to make this a document for people with HS, is that ideally it's going to be not by the doctors for people with HS, but actually for the people, by the people with HS.
Yeah, thank you for your talk today. We're always really glad when we have the specialists that are willing to spend some time with us, and we appreciate your dedication.
Oh, it's my pleasure to be here.
All right, so I think we'll wrap up this session, and later this month we do have a session on research, so the current research and some of the findings. I think, Athena, do you have anything you'd like to add about the upcoming session by Dr. Kirby?
Yeah, so the next specialty session that we have coming up is with Dr. Jocelyn Kirby out of Hershey, Pennsylvania. She'll be talking about research, what we know, what we're trying to know, and how to get involved in research. That will be on the 17th, I believe. Sorry, I don't have the date pulled up in front of me.
I'll give that a quick look.
Yeah, sorry, it's either this, I think I want to say the 17th, but it could be the 24th as well.
Yes, it is on the 21st, actually,
Yeah.
at 5:30 Eastern Standard Time.
Excellent. All right, and then we've got, should we do the wrap-up slides, or does anyone else want to ask Dr. Tan some questions while we still have him here?
I think you can get the wrap-up slides up, and I'll monitor and I'll check Facebook one last time for questions.
Gotcha. All right. So I'm getting better at this. All right, so I didn't get a chance to do this in the beginning, but if you'd like to join us on Facebook, you can. We have a private and a public page on Facebook at facebook.com/hopeforhs. We have our website at hopeforhs.org, and then you can text 31996 to get meeting notifications or sign up for emails on our website. This is still going on, and there's plenty of time to register, but we have a 5K walk, run, and rest for hidradenitis suppurativa awareness. When you register, you'll get the option to walk or run a 5K or 10K or do a rest for HS. And when you register, you'll get this really cool medal and some neat information about hidradenitis suppurativa and what Hope for HS does. If you have had COVID and you have HS, there's a study going on right now, and researchers want to know. So you can go to hscovid.ucsf.edu and register and walk through the research experience with them. As always, we'd like to thank all of our volunteers in our amazing community, our patients, and the people that work with us in getting this information out to the patient community. And that's it. Any last questions, Angela?
Yes, so there was a question about where can I go to find a HS specialist in Tampa? So the HS Foundation has curated a list, and you'll be able to go to that. Just give me one moment and I'll pop that link into the chat. And then someone did ask, how do I lessen my flares?
Well, thanks for that question. I think the flares for HS will vary from person to person. And oftentimes we do hear about some common factors, including friction, as well as dampness, heat, occlusive clothing. But, quite frankly, I think most of the time, a lot of HS patients already know their flare-ups. And sometimes there is no obvious trigger. So what we then look to do is to toggle back to some of the basic factors that we think may be operative. And that is, can we reduce inflammation in the skin? Are there certain products that you're eating or drinking that might trigger it? And although there's lots of research that still needs to be done, I come from the acne world where there has been fairly good research on the role of dairy in triggering flare-ups in acne, as well as the role of high glycemic index diets being problematic in acne flare-ups. So in HS, whether that is true or not, we don't know, but for the most part, I try to help my patients by exporting the information from similar conditions to see if that can help them. And whether they can do it or not is at least something that they're informed about. So typically for acne patients and HS patients, if they can stay on a low glycemic index diet and to practice dairy avoidance, very hard, dairy avoidance in North America. I mean, who's going to not love pizza with cheese and all of those other great delicious foods with cheese? It's very, very tough. And then if you're going to have cereal, you're going to have to use rice milk or almond milk or soy milk. So that's where I would start, though, because I certainly understand when people have recurrent flares, it's extremely bothersome because you just have no sense of what your trigger is. But look for the obvious ones: occlusion, friction, heat, moisture, and then maybe start thinking about what you're eating, what you're drinking, and then we start looking at interventions. And the interventions may be, what cleansers can we use to keep your pores more open? Should it contain some salicylic acid? And because we use that in acne, and we know that poral occlusion is problematic in HS as well. So, there are cleansers that are very gentle, which then you can use in the axillary and groin area, but that also contains salicylic acid, which can be directed to keep the pores a little bit more free of debris. The other aspect is to consider using a little bit of low concentration benzoyl peroxide, because that can help reduce the microbiome that may be problematic in triggering some of the HS flares. And so those are a few ways that we think about reducing flares in terms of prevention. Once it does flare, then we move into what treatments we can use to subside or abort that flare more quickly. So hopefully that was of help.
Before we wrap up, I thought it might be a really good way to end on this thought was that, Dr. Tan, if I'm correct with this was quite the labor, right? It was a large collaboration and there was quite a bit of work put into this aid. Am I right?
Very much so. Yes, you could see all the folks that were involved, and quite frankly, Hope for HS, as you know, was involved as well, because thankfully we were able to get Sandra Guibault from the Detroit part of Hope for HS to help provide us input, and then to help get Hope for HS members to also get involved in the randomized controlled trial and the development process. So I do want to make sure you guys hear the shout out, because we do this because we're trying to really help patients with HS. It's a huge body of work. I can't say enough for the volunteers who helped us and for my research assistants. And at this point, quite frankly, we have no more funding. We're done. So, but we still want to make sure that this is available and that over time, hopefully it can be built upon. It's almost like, you've built the foundations. Can you keep building as progress advances? And that's where the hope is. So the hope for the HS PDA.
Yeah. Yeah, I think it's an extremely important point to end with, and a great note to end on is that sometimes as patients we are unaware of the work that's being done because there's such a great need for it. And this is a really, really neat tool, and there was a lot of work put into it, and it can be really helpful to the patient population. So there was one last question that quick popped up in the chat, and about dairy and the reactions to it. They said they're a vegetarian and they take milk and milk products and they're still getting fissures and tenderness. So do we want to take this last question and then we'll wrap up?
Yes, and as we were saying, there's so many different triggers, and certainly from India, there's heat, humidity, moisture, as well as and vegetarians. Some of my best friends, when they invite me out for vegetarians dinners, their glycemic index food is really moderate to high. So, and I'm not going to take out my glycemic index and take a look at all the foods, but I'm making a mental note that sometimes it may sound, quote, healthy, but when we actually look at the way it transforms into glycemic index, it's actually not as healthy as you think. Now, one of the things about glycemic index is it sounds very high-techy and so forth, and oh my God, there's another thing I have to think about now. It's actually very low-techy. And I want you to think about what your great-grandparents used to eat like. And the likelihood is they probably were really farm to table a lot more than we are. So we are much more farm to warehouse, to processing, to factory, to added components, and then it's shipped out to us and goes into our pantry, and then we do whatever we do with it. So, low glycemic basically means a lot less processed foods and a lot less added sugars. Oh, by the way, I'm going to make a little pitch here for you guys. And I'm sure you have a really good site for low glycemic index in the US diabetes website. But the best one I find for Canadians is Diabetes Canada. And if you go and Google them and you look up low glycemic index diet, they have a beautiful PDF that then comes up with low, mid, and high glycemic index so that it's really simple to follow.
All right. Thank you so much, Dr. Chan, for joining us today and sharing this incredibly helpful tool for patients. We're going to end this session now. Thank you everyone for participating, and I hope you enjoy the rest of this beautiful Saturday afternoon. Bye.
Bye.